So guys, first topic should be CAC. Note down. Computer Auto Suggested Coding. CAC means Computer Auto Suggested Coding. How it will work means, tell me. Have you have idea the software tool? Any idea? No, no.
No.
No. Okay, no issue, no problem. See, guys, what is the computer auto-assisted coding means? Computer auto-assisted CAC is a software tool. Like how we are working, how we are entering the codes in one software tool, right? Any software tool we are using for the leading the code, correct?
Yes.
Same. CAC also a software tool. Okay, it will be works natural language processing. It will be work based on the natural language processing. Please note down what is the processing language for to use CAC. Natural
Natural
language
language processing.
processing NLP. Please note down. Okay. You will get questions like this. What is the software? What is the language we can use in the CAC means natural language processing. Okay. And machine learning to analyze clinical documentation and suggest appropriate medical codes for the patient records. So this CAC software will use natural language process and the machine will learn the document, how we are reading the document, right? Same entire document, this software tool will read and it will give codes for us. Okay. It will give auto suggested codes. The CAC software will code and it will provide for us codes. Okay, just we need to validate the coding. What the CAC software suggested, that code correct or not, we need to check. Clear? Now, while you are coding, you will identify the diagnosis in the record, correct? There is any codes already suggested in the record while you are coding?
Yes.
Suggested.
Already suggested, codes.
Yes.
Yes.
That was the CAC, okay? The
Yes.
software will already suggested. Just you are just validating that code was correct or not correct. By
Yes.
default, you are not entering correct. You will add by default or you will validate that code was correct or not.
We validate that NL validated code.
Yeah, we need to validate right whether it was supported all the diagnosis workup or as per guidelines. Then we need to add. So validation we are doing, correct?
Yes.
Yes.
So now tell me what is the process while we are working in the CAC? What the process we are following? Validation process, correct? We are doing the validation or we are doing the CAC coding while you are working on the CAC software.
We are doing validate.
Validation, okay.
Yes.
So now remember software tool was natural language processing. We are validating the documentation. The importance of auto suggested coding. What is the use? What is the important while we are using CAC software? What is the important things? See, the computer auto suggested has historically played an important in the healthcare industry. The technology is helping healthcare providers and coders improve and increase the productivity. Remember this, okay? How CAC will impact on the coders means what is the impact on the coders? How it will be impact? Increase the efficiency and productivity. Okay, the
Yes.
productivity will increase with, because now 80% or 90% of the codes it will be auto suggested. You just validate and you will submit. So here our productivity will increase, right?
Yes.
Before CAC, suppose I'm saying before the CAC who are working on the 100 charts per day coders, after implementing on the CAC, the 30% productivity was increased. Okay, they changed the targets for coders, more than 30% they increased, but still they are achieving the target. Why? Because they are getting more validation charts. So here they are not coding directly, they are validating. So remember what is the use of CAC software, how it will be impact on the coder means increase the productivity.
Productivity.
Next, the role of computer auto assisted coding in healthcare. What is the role? CAC plays a role in healthcare by helping providers and coders assigning codes to patient records. These codes are essential for billing, reimbursement, quality reporting, and other clinical healthcare system functions. So the CAC will suggest already codes. We need to assign the document. Then benefits increase the productivity and efficiency of coding, medical coding workflows. Remember, okay?
Okay.
Yeah. Now I will ask one question. So one CAC software suggested auto suggested code, okay, unspecified, but you found in the record more specific code. So how you will code in the record?
More specific code.
Correct. Okay, we need to code as per the documentation highest specificity. Correct.
Yes.
So suppose CAC suggested diabetes code, but in the record have diabetes in the history and neuropathy in the assessment. How we need to code? Only diabetes we need to select, or you need to code more specific diabetic neuropathy code?
Diabetic
Diabetic
neuropathy.
neuropathy.
Yeah. Diabetic neuropathy we need to code. Okay. Remember. What is the software tool? Na? Natural language processing and machine learning algorithms. Okay. In the options you will get natural language processing. Simply they will tell NLP. Okay. Remember NLP means natural language processing. Clear?
Yes.
Yeah. So in this concept, you will get two questions. Okay. CAC software tool. What tool we can use? What language we can use in the CAC? What language?
NLP, natural learning, language processing,
Natural language processing. How it will impact on coders?
by increasing productivity and efficiency.
Yeah. Increasing productivity and efficiency. CAC suggested unspecified code, but documented more specific code. But the record, medical record documented more specific code. How we will code?
We will code more specific.
Code as per
Medical
the
record.
record highest specificity, correct?
Yes.
Okay, thank you. Good. So now you understood the CAC, right? What is the meaning of CAC? How it will be impact on the coders? What language we can use in the CAC software? Okay, these are the things. Okay. Next, so one more software we have Encoder. Have you remembered this Encoder too?
Yes.
Yes.
Same. Encoder also one software. What is the use of Encoder? Where we can use? What is the purpose of Encoder?
For leading the codes.
Leading the codes for billing purpose, correct?
Yes.
So they will give what is the use of encoder to use the software to code for billing. Sometimes they will give to take the appointment of the patient in the options like that they will give. Okay, you need to select to medical billing purpose to lead the codes. Encoder software. Clear? Encoder and CAC related you will get 3 questions. Okay.
Yes.
Next, high tech and HIPAA we can discuss. Yeah, what is the meaning of HIPAA? Health Information
Portability and accountability.
Portability and Accountability Act. Okay. How it will be work on the medical coding, this HIPAA? What is the use of HIPAA? Where we need to use HIPAA? So remember to
Save the
protect the patient health information or protect the health information. Okay, to protect the health information we can apply for the HIPAA Act. Okay, so remember what are the most common violations. You will get some violations in the question, like they will ask which of the following is a HIPAA violation. They will ask. They will give 4 options. We need to identify the exact violation from the list. Okay, like that you will get 3 questions. So these are the most common violations. Snooping on health records, failure to perform an organization-wide risk analysis, failure to manage security risk, lack of risk management, denying patients access health record, exceeding timescale of providing access, failure to enter into a HIPAA compliant business associate agreement, insufficient PHI. EPHI means electronic. Okay, E means electronic protected health information. Remember, PHI means protected health information. Failure to use encryption or equivalent measure to safeguard of EPHI and portable devices, exceeding the 60-day deadline for issuing breach notification. So if you misuse the any breach, okay, if you done any violation, we need to give escalation within 60 days actually. If you misusing that 60 days, you are not giving within 60 days, it will be again violation. Okay. Impermissible disclosure of protected health information, improper disposable of PHA. So now I will ask some examples. You can tell me it was a violation or not. Okay. Please identify. Mm. Patient uh, patient room number was described on the whiteboard. It was a violation or not?
No.
No. Yes.
No.
No. Okay. It was not a violation. It was common thing, right?
Yes.
No. No. Patient discussed about the patient health information with relatives.
No.
No.
No. We can discuss. No. Two nurses discussing about the patient health information in the lunchtime during hospital lobby.
Violation.
Yes. Violation.
Violation. We should not discuss about the patient health information outside, right?
Yes.
Yes. They're sending patient health record through mail.
Can you repeat?
They are sending the patient health status through mail.
But if they are sending to patient, it will be okay.
No. It was a violation. Okay, we should not
Okay.
send the mail and all. Maybe it will be violated easily.
Okay.
Mhm. We should not send through mails and all. Clear? Remember. These are the violations of HIPAA. Like next, how many years we need to maintain the health record data means minimum 6 years we need to maintain. Okay,
Yes.
minimum 6 years we need to maintain. Then high tech you will get here also. What is the meaning of high tech? Not the high health information technology for economic and clinical health act. Okay, high tech was the part of HIPAA. Okay, this the act also introduced through penalties for violations of HIPAA. This also a part of HIPAA, high tech. Okay, so high tech means the health information technology for economic and clinical health act or high tech simple term. Okay, this also a part of HIPAA. So it will be provide the meaningful use of EHRs. We discussed this thing, right? Instant way the meaningful use of EHR. One question you are getting here, no? What is the high tech will provide something?
Yes, we have one question.
Yeah, the meaningful of use of EHR. This. What does high tech require to provide to implement EHR means the meaningful of EHR. Okay, then so what is the use of high tech means we can discuss. What are the goals? So the high tech will implement on the electronic health record, guys. Okay, it will work on the electronic health record. Now we are doing all working on EHR records only, right? We are not getting any paper record, correct?
Yes.
In electronic health record format only we are getting, correct? All the medical records. So we need to check, improve quality, safety, and efficiency, engage patients in their care, increase coordination of care, improve the health status of the population, and ensure privacy and security. These are the goals for the high tech. Clear?
Yes.
These are the high tech goals. Next, where you will get question. Meaningful use of program we discussed. No? It will be work on the adapt to the EHR. A program that incentive providers to adapt to certified EHRs. So meaningful EHR was the meaningful use program for adapt to the EHR, electronic health records. Next, what is the EHR? EHR means an electronic health record. Okay, it was the electronic health record. EHR means. So, what is the use of this EHR? How it will be work?
It will contain the patient information.
Yeah, in the EHR, in electronic health record format
Digitally.
means we
Yes.
can document the entire health care journey of the patient in the real time. Okay, we can maintain all the medical history, medication, immunization, all the data. In the paperwork, the paper format, we should not maintain all the data, correct?
Yes.
Okay, we should not maintain the all the records in the paper format. Okay, see, so how do EHR different from the electronic medical record? Simply put, EMR or digital version of a paper chart. Okay, EMR was the electronic medical record, EHR was the electronic health record. They contain the medical and treatment history of the patient in one health record setting. Electronic health records go further, more than just notes for a single care provider. EHR also include range of functionalities. Okay, in the electronic medical record you will get only patient information, but in the electronic medical records, but in the electronic health record, you will get range of functionalities like laboratory tests, specialties, all other words. Okay. In electronic medical record, you will get history and patient health care. But in the electronic health record, you will get laboratory and other specialties also. That's it. Okay, so now we can go for this type of questions in the record paper. Tell me 138 question. What is the primary reason to what is the primary reason in this option? For protecting patient privacy and maintaining the security of health information, for determining reimbursement rate of healthcare service, for expediting the coding process and productivity, for preventing fraud and abuse of healthcare billing. What we need to focus on the HIPAA mainly
Protecting the patient privacy.
protect the privacy and maintain the security of health information. Who covered HIPAA violations means remember covered entity business associated and a member of either workforce. Okay, this will cover the HIPAA violations. Covered entity, business associate, and a member of either workforce. Then health plan does not fall under HIPAA. Which health plan will does not fall under HIPAA means workers' compensation will not comes under HIPAA guidelines. Note down. Workers' compensation. Workers' compensation will not comes under HIPAA. Yeah, when we follow the state law instead of HIPAA guidelines, note down this also. When we need to follow the HIPAA guidelines compared to state law, when we need to follow the state law instead of HIPAA means when the state law was more stricter than HIPAA violations. Okay, if more than HIPAA guidelines, they are following more strict guidelines, means we need to follow the state laws. Yeah. 1/10 question, tell me. Please understand the question. What they are saying here? Hello.
Hello. Yes.
Yeah, what they are saying in the question.
What the purpose means, what the role should be nurse should apply when he has
Yeah,
an
see here.
ex-boyfriend.
So here, remember, HIPAA violation was okay. This also HIPAA violation question. What will happen? A
Yes.
patient was admitted with injury. Okay, that injury how it was happened? Beaten by girlfriend. So who he was admitted in the hospital, but in the hospital page, nurse was her ex-GF. That patient ex-GF. So what is the nurse role here? She need to maintain the protected health information or she need to disclose all the details.
Protect the health information.
Yeah, because she know everything about patient, but still she should not tell, right?
Disclose.
Should not disclose. Okay,
Yes.
we should not disclose the patient details. We should maintain the protected health information. Next, what is the advantage of high-tech rule means? Based on the high-tech rule, providers get increment and incentives. This is the advantage. Okay, providers get increment and incentives. Next. Yeah. While patient handling the patient record, coder have to take care of what we should need to take care. Do not disclose the
Health.
Patient information.
patient in health information. We should not disclose the patient health information. We need to protect the health information. Next, what is the standards of EHR? Electronic health record standards was data visualization. The benefit of the EHR was we can visualize the data anytime. Next, transmit patient health information procedure information for billing purpose is which type of HIPAA violation? Accountability. Okay, accountability violation. Clear? Accountability. Next, 90th question. So here what will happen now? Patient was making all the patients was new patients compare even older patients also. Okay, all the patients they making
Super bills.
super bills. They are doing super bills for even new patients also. Clear? So what we need to do? Coder.
Hello.
Hello.
What
What
is
we need to do now? Hello.
what
Tell me.
is what is super bills?
Super bills means more bill compared to normal bill. Highest bill. Okay. Like while you are working, they are doing payment like highest payment. What they done work, but they doing okay. Okay, team. Because if while we are working in ENM coding, you have idea about ENM coding. You listen that word.
Hello.
So yeah, have you listened the ENM coding, right?
Yes, we have heard of it.
We heard now. So while you are working on the ENM now, we need to have new patient and established patient guidelines. Okay. For new
Yes.
patient, we have separate bill. For established patient, you will get separate bill. Here, what will happen now? For all the established patient, like old patient also, they are doing. These are the new patients like that. Okay. So the coder was identified, but he informed to provider means provider was not responding. He saying this is nothing. He doing always this.
Okay.
Okay.
Correct? So that's why we need to complain to the complaints officer. Next. Next. Which government agency offers compliance program guidance for physician practice? OIG, Director of Inspector General. Next. They identify one employee forget their card in the car. But thief theft that ID card and they entered into the hospital lobby. They identified by using the CCTV footage. How they caught the thief? Which complaint? Which tool they used? Administrative, technical, physical.
Technical.
CCTV comes under
Technical.
technical, okay? Technical. Next. Which of the following is a HIPAA ethical violation? What is the ethical violation means? What is the misuse of ethics, coding ethics? So employee correcting the codes without information of his supervisor. So if you correcting others coders records without involvement of supervisor, it was a violation. Okay, we should not correct other coders records without information of the supervisor. It was a violation. Next, which of the following option was a HIPAA violation? They will give some options, guys. Remember, in the options, you need to get two nurses discussing about patient condition in hospital lobby at a lunch time. Okay, it will be violation. Clear?
Yes.
We should not discuss patient health information anywhere outside. Then the rule which restricts entity without disclosing the patient details. Which rule restricting the patient details without disclosing means privacy rule. Privacy rule will protect the patient details. Based on the privacy rule, we need to maintain the patient details, all the details. Yeah. Next, what HRM manager do at an emergency crisis or event? What the crisis when crisis event happened in the industry? What HRM manager to do now? They need to take first facility safety plan. They need to protect the facility. They need to implement facility safety plan. Yeah. Next, what is the term for the process of assigning unique identifier to each patient, provider, or location to facilitate data exchange and tracking? What is the use of this providing unique identifying numbers? Data mapping, data warehousing, master data management, or identity data management? Why we can provide all the details? Like unique identification number for the area or hospital or provider for identity purpose, correct?
Yes.
Okay, for the identity purpose, they will provide a unique identity number for the identity management. Then tell me 55 question. What is the HIPAA violation in these four options? Talking patients with caregiver near consultation in ED. Patient signing in appointment with only first name. Nurses writing patient room number on whiteboard. Patient getting insulin strip glucometer through mail.
Option
Mail
C.
one.
Option C, okay, because we can write the room number, we can sign with only first name, it was not a problem. We can talking with patient caregivers, it was not a problem. But we are sending the insulin strip means they will get the details of patient blood sugar levels, correct? So
Yes.
it was a violation. What is the use of software encoder? Encoder software use. Appointment
You
for
can start.
treating or medical record documents convert into codes for billing.
Medical record document converts into codes for billing.
Medical record document converts into codes for billing. We can convert the codes for billing. Next, we can discuss one guideline here. 22 and 23 questions, you will get a clear idea. H&P must should. This also a complaints. History and physical, how need to collect. How we need to collect. Seven steps. So guys, here read up to here. A medical history and physical examination. H&P must be completed and documented in the medical record. Please read highlighted lines and understand. What they're saying, H&P must be collected or documented
No more than 30 days or before 24 hours
no
after an
more than
admission.
30 days prior.
Prayer, yeah.
Then or after
After
admission
admission,
within
24 hours.
24 hours after an admission or registration and prior to any high risk procedure or surgery. Okay.
Yes.
So now we will get based on this question, this concept, two questions.
Okay.
So we can discuss the two questions. Tell me 22 time frame to collect HNP of patient after admission in IP. How many hours?
24 hours.
24.
Within 24 hours, correct?
Yes.
Yes.
Mm. 23 question tell me. According to Medicare requirements, a HNP must be completed for each patient.
No more than 30 days. and before
No more
24
than
hours
30 days
after
before or
admission.
within 24 hours after admission or registration,
Admission.
but prior to any high risk procedure. Correct?
Yes.
So please remember this concept. Okay. A H&P within no more than 30 days before or 24 hours and after admission, we need to collect. Yeah. 18 and 19. Programming language used for CAC.
NLP.
NLP, natural language
NLP.
processing.
How CAC software will impact encoder? Increase the productivity
Productivity
and
and efficiency.
efficiency of the coder. Which organization established the high-tech rule means ONC. Okay, ONC was the established this high-tech rule. We discussed now high-tech. ONC was established this high-tech rule. Office of the National Coordinator.
And OIG for, sir?
OIG for some other guideline. No? Privacy something that was.
Okay. Yes, government agency offer compliance.
OIG was to protect the health information. Something like OIG complaints. Huh? Which government complaints program
Compliance
guidance?
program. For physician, it's
Yeah. For physician practice, which government agency offers complaints program guidance for physician? No? OIG.
OIG.
Who established the high tech? No? ONC.
ONC.
Okay. ONC. These are the guidelines related to complaints questions. So go through these questions all. Tomorrow we can discuss queries and all. Okay. Query questions and all remaining questions. Then we can close your training by tomorrow. Clear?
Yes.
Then you can take time to prepare 1 week and we can apply for the exam March first week onwards.